Okay, we're gonna do blood transfusion. So we're gonna go through the top of your sheet. You're gonna see all the supplies that you need. It says 250 mils of NS, but we're gonna go with 1,000. Okay, you need your blood tubing. It always has the red writing here, and you can see the Y at the top. Okay, this is Y tubing. Alcohol wipes, your sterile gloves. We don't have this yet. Of course, you're always gonna verify the physician's order. There is a book here that's set up for you guys to go through. Verify the physician's order. You want to make sure that yes, the doctor has ordered a type and cross packed red blood cells. I don't know what the ramifications would be of giving the wrong patient a blood transfusion, but I'm sure it would not be good. So please make sure that your patient for sure needs the blood transfusion. So you're going to look and make sure, yes, this patient does need a blood transfusion. History, allergies, you want to make sure, you know, no known allergies. Okay, that's great. You also want to make sure, have they had any previous transfusion reactions? If they have had a previous transfusion reaction, the doctor may still, if it's needed for their life, then the doctor will still order it. He'll just give Benadryl or a steroid that will help them get through the transfusion depending on what reaction they had and how severe it was. Okay, review pertinent labs. I just want to show, so yes, because you want to make sure, like, why are we giving this patient a blood transfusion? Because most people are really scared of a blood transfusion. You want to make sure that, yes, this was ordered for them. So, yep, H&H are low, so that's a good indication, yes, they are going to get a blood transfusion. Again, so we reviewed the labs. We need to make sure, do not give a blood transfusion without them signing a consent, okay? They need to sign it. It's probably mostly electronic now, but I just wanted you to see this. They sign it, you witness that they signed it, okay? All right, give pre-medication. Like I say, if they had a transfusion reaction, he will say, give Benadryl or a steroid to help them through the transfusion if it's still needed. All right, so now you're ready. You've checked everything. We're gonna go ahead and do K-wipes, knock, come in, you do all your stuff. You're responsible for that. Always hand hygiene. Okay, hi. My name is Sarah, I'm gonna be your nurse. Are you Amanda Shaw? Yep. Do you have any allergies? No allergies. All right. Confirmed that. Verifying the allergies. We also want to make sure that this doesn't show it, but I will show you so on their armbands, they will have a blood band that will tell you their account number and what they are, AB negative. Okay. So you want to confirm that it's on the patient. That yes, lab has been here, they've typed and crossed them, they're ready to get a transfusion. Another thing that you want to check is to make sure that they have an adequate IV and is it running. Okay, this patient doesn't have anything running, but I'm just going to confirm, yeah, that's open. If they don't have a line going, flush it just to make sure it's open. Okay, and then what you're going to do, you're going to discontinue their fluids, whatever that they had going. Okay. And then you discard this. No matter how full it is, you discard it, because once your transfusion is done, you're going to hang new fluid, new tubing. Okay? So we'll just remove this. They're all done with that. All right, so again, we want to make sure their IV is the appropriate size, 20 gauge or larger. So you just want to make sure that, yes, they have the appropriate one. If they don't, you need to start another one. Okay? Again, you want to go through with the patient about why they're getting a transfusion, what it's for. You've got a low H&H, so we just want to help you feel better. If they had shortness of breath, you want to say this will help, you know, carry oxygen through your body, will give you the blood transfusion. And then you always go over signs of reaction, hives, itching, shortness of breath. Some people get anxiety, which a lot of people get anxiety because they're nervous about it anyway. Chest pain, anything like that, you want to make sure and report to the nurse. Okay, make sure they know where the call light is, confirm that again. Okay, what we're going to do is we need to get started with our NS and our blood tubing, okay? So we'll open this. New NS. Okay, make sure it comes from a bag. Open your tubing. Tear off all your little tags, right? All your stickers. Lock everything. And you want to lock both of your Ys. All right, one will be for blood, one is for NS. Okay. All right, now we need to prime the tubing. So this is one of the parts that is just interesting for blood transfusions. Okay, so hang that. What you're gonna wanna do, don't let that drag the floor. All right, you get an alcohol swab. Make sure that, okay, 10, 20, 30. Well, we need to prime that first. We'll do that again. All right, so what I'm going to do, I'm gonna leave this locked. I'm gonna undo this and then watch slowly as this starts to fill this. You see it's filling up through this filter. You need to go, the NS needs to go above this filter. Otherwise you run the risk of damaging red blood cells. If it doesn't fill for you when it fills the rest of your thing, go ahead and okay, just make sure it's above that filter. All right. Just make sure you don't have a whole bunch of bubbles. Not that it's a huge ordeal, but, and then we're going to prime this. If you hold it down, it'll just prime on its own. Okay. You probably can't see that in there, but it's primed. It came up into the cap, okay? And you can just leave that there. That's ready for the blood. This one's gonna attach to the blood. Okay? All right, we're all primed. My hands are wet. I'm gonna do this again. Okay, and what you're gonna do is you're gonna start this line just as a TKO. I like 30 mils an hour as TKO, so when it's on the pump, you can hook it up to the pump and start it at TKO. Remember, this side's still locked. We're just gonna make sure, yep, I can see dripping through here. We just wanna do TKO. Again, I like 30 mils an hour. So we just wanna make sure it's open while we go get the blood so that when we come back with the blood, we're just ready to initiate, okay? So yep, that's running great. Okay, I know now that I'm ready to go down and get the blood. I always like to do a set of vital signs right now, just in case there was something that needed taken care of, say a high heart rate, fever, something that would tell us that we probably shouldn't do the transfusion. Go ahead and do a set of vitals because we're gonna be getting the blood and starting that soon. So what we will do is we take a patient sticker out of the chart. I need to make sure that tells you that. Okay, oh, and again, no other fluids or medicine can go through this line. Once you've started a blood transfusion, that's it for that line. If they have something else that needed to be going, you need to start another IV. Okay, all right, so we take a sticker out of the patient's chart and you go down to lab. Okay, you go down to lab. They will walk through everything with you. They want to go over the patient. They want to know date of birth, MRN. They'll go through everything. They want to know the account number, the blood component. They want to know, yes, we've got packed red blood cells, and they should have that. They're just confirming it with you, but you go through it with you. So you'll be holding, they'll be holding the blood, you'll be holding the sticker, and they'll just go through, is this person? Yep. Is this the account number? Is this the type of blood? Yep, packed red blood cells. We're giving 1 unit. And it expires. Okay, it's good. We can still give it. Still got a whole year before this expires. Okay, so they're ready. Then they'll say, all right, go ahead and take it. So you'll take it back up to the room. Okay, you make sure that you don't shake it. You just hold it gently. You don't want to break those red blood cells. Okay, no lysing of the cells. You don't shake it, but you do inspect it for bubbles, clots, leaks, anything like that. Just make sure that it looks safe and everything looks good for it to give to the patient. All right, so you go back to the floor, another nurse will come in with you, and again, you will do the same thing. This is how serious it is to give a blood transfusion. You gotta make sure you have another nurse. You might see now where they aren't using a second nurse, the computer will be your second nurse, but for this pass off, we're doing 2 nurses, just so you can get used to that. So you're gonna go through the exact same thing you did with lab, with the blood bank. Okay, so you go through everything and it's right on here. They'll be looking at this. They'll confirm that yes, there's a doctor's order with you. And then you will sign there's a transfusion record. So this will be in the computer, but I'm just showing you what it looks like so you can see it. Okay. So on the blood bag, there is a ticket, a little ticket that comes like this. 2 nurses will sign it that yes, we've gone through the patient name, the account number, the RBAN number, the ABORH. Okay, everything pans out, everything's together with this blood. It's okay to give it to this patient. Okay. All right. So, and again, before you start, you need to chart your first set of vitals in the computer, and then you're okay to start giving this. So we need to do hand hygiene again. You're getting ready to deal with the blood. Put your gloves on. All right, and you get ready to attach this. So we have to reuse these bags, so if yours has these hemostats on it, you just take that off. All right, so here we go. We're gonna go ahead and open this up. Okay, take the other half of your Y that's already primed. Okay, and your pump's still going at 30 mils an hour. It's still locked. We're gonna hang this up here. We want to be able to see, I kind of already know that that's the NS, but I want to see my blood, right? So what we're gonna do is you go ahead and lock the NS, okay? Because we're ready to do this one. So go ahead and open this, and it should start draining, hopefully. There we go. All right. So you can open this all the way. The blood transfusion technically doesn't start until it reaches the patient's arm. So if you put it in the pump, you could say 999 mils an hour. That would fill that really fast. Sometimes it fills really slow, depending on the tubing, whatever it is. We'll see how fast this goes. But you can see it. This is a pretty good representation of what it does. It just starts to fill this chamber. Okay, and that's why we did the NS to the top there. We don't want to lyse those blood cells. So you'll see it just starts to turn pink. Okay, so you can see this takes a minute. That's normal, unless you put it through the pump and it goes and you want to do it super fast. This one's actually filling pretty fast this way, which is fine. You can just wait for it. This isn't a super fast procedure regardless. Okay, so still pink, but it is close to the patient. So I'm gonna go ahead and say right now that this is starting for my patient, and you keep it at TKO, you start it on a low rate. Okay, start it at 30 just for your first 15 minutes, just to make sure the patient tolerates it. I've seen people react to blood within a few minutes. Like if they start itching or something, they can react pretty fast. Okay. So we'll go ahead and say that that's flowing. All right. So it started in the computer. You're going to say, this is what time the blood was started. And you got to sit with that patient for 15 minutes. If you're in there, this was the time I like to chart. Okay. 15 minutes. You got to sit with the patient, hook them up to their Dynamat. Just make sure you're doing vitals. It's, the first one's every 15 minutes. You're supposed to do every 15 minutes times 2. And then every hour until it's done, and you have 4 hours to get the blood transfusion in. Only 4. And remember, once you pick up this blood, I don't think I said that, once you pick up this blood from the lab, the blood bank, it needs to be hung within 30 minutes. If you can't hang it within 30 minutes, you need to send it back. So that's why you've got to have everything ready before you pick up your blood. Okay? 3 feet, hang it 3 feet above the patient's heart. Okay, we went through all of that. Once you're done, let's say that this is empty, okay? It's empty. Hand hygiene. Put your gloves on. Okay. Let's just say that bag is empty. You're gonna come over here And just lock that for just a second, okay? I'm gonna lock this. Oh, that's leaking. You open your NS, okay? And so this is locked. Normally there would be nothing left, but you just open your NS side and it starts to, you'll see pretty soon this starts to look pink. It takes a minute to clear that all the way out. But until the blood clears the tubing, they don't consider the transfusion done. So we'll see here just a second if it's gonna work. It takes a minute for everything to start turning more pink. Okay, but until this line runs clear, I'm not gonna wait for that, but you can see kind of at the top how that's starting to clear out. Okay, it'll flush that in and pretty soon it'll start to look pink just like it did when we initiated it. So once that's all the way through, then we can say this was our end time, okay? So that's our end time for our blood transfusion, and you'll need to mark that on the paper. If you can see here, so this is where both nurses signed it at the beginning, saying, confirming that. Start date time, end date time, and the volume given. So this one had 300 mils, it's always on the bag. Sometimes it says 210, 290, so it always says something a little different. So 300 mils of blood is what was given, and then we did 30 mils an hour. We could just, a lot of times I'll just say 30 mils of NS was given. And maybe you could say 60, because by the time we run that through, it might be 60. So you could say 360 total was given, 300 for blood, 60 for NS, because you need to know the total volume given, okay? Once that's done, you disconnect everything, okay, and hang a new bag and new tubing of what the doctor previously ordered. If they were on NS or LR or D5 half, you hang that again with new tubing, new bag, and start it fresh. Then you go do your documenting at any time. And again, when you finish, make sure the patient's comfortable. Call light. Just because we're done with the blood transfusion doesn't mean that they can't have any reactions. They certainly can still have reactions for a long time after getting their blood. So make sure they know where their call light is, make sure they're comfortable. Again, give them some signs to watch for, and then you do your documenting. Again, we talked about that. Start time, end time, the volume given, patient's response, any pre-assessment, condition of the IV site. Okay, yes, we did hang new tubing. There is always a place, let me show you. There's always a place in the computer where you can chart reactions, a report of suspected transfusion reactions. So this kind of goes through. Class 1 is just your hives, itching, headache. Class 2 goes through a little more. Class 3 is more like dark bloody urine. Things get worse, right? Call blood bank immediately. Stop the transfusion, but keep the IV open with the saline drip using new saline. So if your patient is having any sort of a reaction, stop the blood completely, take out the tubing, and start NS with new tubing. Like, you need to flush that out as quickly as possible. Okay, and it'll walk you through all the things that you need to do if your patient is suspected of having a transfusion reaction. Again, a lot of patients already have anxiety from getting a blood transfusion, so just be aware of that. And I think that's it. Call 911 if you have any questions.